So when performing a transfer to bed, the first aspect of this is to dock the chair. So you want to make sure that the wheelchair latches line up with the black plates on the dock, and you click that in, note that noise, and then you want to go to transfer functions and you want to press transfer to bed. So on the screen it's going to tell you that the chair is docking. You want to make sure to watch the wheelchair or the dock plates going over the wheelchair latches. And what's going to happen is the chair is going to go back to meet the bed, and the sheet is coming midway down. It should come about halfway. Also make sure that the wheelchair handles are pushed in, because the chair is going to meet the back of the bed. At this point, also make sure that your patient's legs are in the right position. So the bed is coming up to meet the back of the chair. So it's prompting me now to lower the back of the chair. So I have to perform this action before anything else can continue in the transfer process. So lean your patient forward. You then push manually the chair back down. If you have a pillow, you can put that behind the patient's head so it makes it more comfortable. And then you continue pressing transfer to bed. We always say to make sure that the patient's hands are in the middle of their chest or their stomach, just so it's a safer transfer. So the bed is going to flatten, and once it flattens, the conveyor is going to start moving the patient onto the bed in conjunction with the seat rotation. So this is also a point where if you need to pause just to make sure that the patient's feet are in the right position, you can do that just by taking your finger off the button. And you can see the bed is slightly raising as the patient is being put into the bed. So the transfer is complete, and the reason the system knows the transfer is complete is because there are actually red circles right here, and those are sensors. So those see when the patient's feet have passed. So as you can see, the patient's not fully in the middle of the bed, so that's when we would use the sheet up function. So I press sheet up just to move her a little bit more comfortably in the bed. Then this is where I can perform some bed functions by putting the head up, and also the leg up.